When I'm walking into the operating room, the first thing comes to mind is, who is this person? And what is their goal and what do we want to do? Because that changes. We do ACL, we do shoulder replacements, we fix rotator cuffs, we fix meniscus, we do cartilage, but they're different in every patient. And every patient has a different expectation or a different goal. After doing surgery, the rehabilitation is just as important as the surgery to getting better. But everybody's different. Everybody's knee's different, everybody's shoulder's different, everybody's injury's different. So I have not just one ACL protocol for after surgery or one protocol for rotator cuff repair. I've got dozens. And we create one almost every time I go to the operating room because we find something unique about the patient. And I find if I make those adjustments as we go along, it really optimizes the patient care and gets the best outcome for that specific patient. I had an 8-year-old present himself with an ACL tear. At the time, there was no real definitive way to do the surgery very safely. And so with this challenge, I sat down and talked to some companies about developing some instruments and came up with a whole new surgical procedure that allowed us to fix his ACL in place without crossing the growth plates and eliminate the risk for damage to them. The surgery was successful. He's now, it's almost a decade later, and he's in his adult life has lived a very active and is still active doing sports like martial arts and things. And since that time, I've taken this instrument, this technique, we've published it. I've helped many more patients just like himself that I can think of that have gone on to play football in college and other sports. And something like that, just a real rewarding experience. So I had a very active patient of mine come to me. He was the head of the Chicago Rugby Club, and through playing rugby, had sustained multiple dislocations. He went to one of our regional institutions and had surgery to fix his shoulder and repair the soft tissues and the dislocations, but that even failed. And I developed a procedure that restores his socket anatomically and does it arthroscopically, which is much better for the patient. It was actually the first one done in the United States. Since that surgery, his shoulder has stayed stable, he's been returned to activities, he's powerlifting. The standard of care still has some limitations. Being a researcher, being a developer, being an innovator, and bringing that to my patients is really powerful because we can do better.